Good morning. I am Dr. Azim. Please have a seat for Mariam and also Aisha. And may I know why you are here today?
Good morning, doctor.
Good morning, doctor. I'm Aisha. Actually, I have been having tummy pain. It has been 5 days.
Oh, can you tell me more about the pain that you are having?
I think the pain started suddenly and it feels like cramping. It's more on my lower part of my stomach, and sometimes I feel really dizzy and nauseated after eating. So because of that, I lost my appetite. Actually, I'm quite worried.
Oh, okay. So you're saying this tummy pain you have for 5 days. So where is exactly the location of the pain? Is it you see on the
Mm,
lower part? Is it on the right part? On the left part?
uh, I think it's more on my right side.
More on your right side. Is it radiate to anywhere else, or you just stay in that one particular area?
I don't think so. It radiates to at somewhere else.
Oh, okay. So regarding the pain, if I give you a pain scale from 1 to 10, which is 1 is the less pain and 10 is the most painful one, what is the scale of your pain that you are having?
Mm, could it be around 5 or 6?
Oh, okay. So when the pain comes, what actually did you do? Did you eat any medication to relieve the pain?
No, I
No.
don't do anything.
Oh, okay. So I think yes, I need to check you first. Okay, for Mariam, can you please wait outside for a while? I would like to speak to Aisha and also examine her. We will call you in when we are done.
Okay, doctor.
Okay, Aisha, before you proceed with abdominal examination, would you like to tell me anything else, Aisha?
Well, to be honest, I think I'm pregnant because I have missed my period for a few weeks, and
Yeah.
then I decided to buy a pregnancy test kit, and the result is positive.
Okay. Are you married, Aisha?
No, but I have a boyfriend, and my family do not know about him.
Oh, okay. Sorry, Aisha. I need to ask you a few more questions that may be sensitive, but this will help us to give you the correct treatment lah. Are you okay with that?
Yeah, carry on.
Yeah. So, you and your boyfriend, are you guys sexually active?
Well, yes. We have been together for 2 years, and to be honest, I was pregnant last year, but I aborted because my boyfriend and I were not ready to settle down for a family. But my mother did not know about this. And can you please not tell her?
Yeah. Okay. Sure, we can do that. But first, Aisha, please don't worry. Do not be anxious. We would like to examine you first, and we'll see from there whether the condition we will get the right treatment for you lah. And my focus here is just to manage your condition and give you the best treatment we have lah.
Okay, but I really do not want my mother to know. Otherwise, you can proceed.
Okay, based on what you told me earlier, and from my examination and also the scan that we have done, I'm suspecting ectopic pregnancy. Have you heard about it, or do you know anything about ectopic pregnancy, Aisha?
Sorry, what is it? Ectopic?
Yes,
No.
ectopic.
I
Oh,
have
no.
no idea about it. I never heard of it. I don't know.
Okay, so I tell you lah, I explain to you. So basically, normally the baby will grow inside the womb, but in your case, Aisha, the baby is located outside of your womb.
Mm-hmm. Then, is it dangerous? What will happen?
Yeah, so basically because it is an abnormal site, which is the tube is not expandable, so there is a risk of rupture of the pregnancy, and this may lead to serious consequences like your BP, your blood pressure will become low, and subsequently can even lead to death if this is not treated early.
Mm, that does not seem like a good news to me. Can you please tell me more? You mentioned about rupture. How actually it can happen?
Oh, okay. I have a picture for you. Wait, Okay, so Aisha, this is a picture showing your womb. So basically, in this middle part is your womb or your uterus. So this is the place where the normal pregnancy occurs in this wall that we call as uterine wall. So basically, this part is very strong enough to support the pregnancy as the baby grows. But in the case of ectopic pregnancy, it can occur here outside the uterus in this tube we call as fallopian tube, and at this side it is not elastic and it cannot expand as the baby grows. So in the meantime, it can lead to rupture and a lot of bleeding can cause fatal to your life lah. So do you understand, Aisha?
Oh no! What will happen if it ruptured?
So, Aisha, so when it ruptures, it can lead to massive bleeding in your belly, which can be fatal.
Oh, I see. Then, what is the best thing to do now?
So I think the best thing to do now is I need to refer you to the general hospital for further management by the specialist, by gynecologist. And since your condition is quite serious and you are underage, I have to discuss it with your mother first before I do that. Is that
No,
okay?
no, that's not right. I'm a dead meat if she knows. Serious.
But do you think it will be better if your mother knows about it? Because this is very serious situation that needs the decision of your guardian, and as you are below the legal age. And also there are a lot of potential serious complication, and the treatment possibly need a surgery to treat this condition, and you will need all of her care and support while you undergo the treatment. And even now when you need to be brought to the hospital, I think you might need a legal guardian with you, especially your mother, to help you.
Yeah, I got your point, but still, I don't think so, doctor. My mother has a black belt in taekwondo. She is really furious.
Okay, so
I'm not kidding.
yeah. But I understand your worries when your mother knows about it, because it is sensitive issue. But I think, but if your mother knows, she can take care and comfort you if you are in pain or admitted. Furthermore, it is my responsibility to inform her. Would you like to talk to her by yourself first?
No. No, I really don't think she will understand my situation, doctor. Please.
Okay, Aisha. I respect your decision, but I think your mother has the right to know, even you would want her to know lah. And if I find that your mother does not understand the severity of the problem and may not follow my advice to bring you to the hospital, or your mother really insists to know, I'm afraid that I must tell her the truth, because this is potentially life-threatening to you. However, please keep calm and not to worry too much, because based on my experience, mothers will usually be angry initially, but they will do their best to help you lah once they understand the condition of the current circumstances lah. That's how a great mother's love is lah. So furthermore, even if I do not tell her, she will find out about it from the doctors at the hospital too, and because she will need to give consent for any surgery or procedure that will need to be done to you. So, however, I promise to inform your mom sensitively if necessary. Is that okay for you?
No, but it's okay. If you think that's the best, then I have no choice.
Doctor, how is my daughter's condition? What's the problem with her?
Okay, Puan Mariam. Firstly, I'm glad that you bring Aisyah to the clinic early because I suspect that she may have a serious condition which requires us for urgent referral to the general hospital, and maybe there is a need for surgery. However, she is not keen for me to inform you the details about her condition.
But I am her mother, doctor. She is underage and I am her legal guardian. So basically, I have the right to know everything.
Okay, yes, I understand, Puan Mariam, but please be calm first. This is your daughter request, and maybe you can talk to her first lah before we further continue with anything.
But it is not right, doctor. You are the doctor, so you must inform me the situation before I bring her to the hospital. If you insist of not telling me, then I'll write a letter and report this to the higher authorities. Please, doctor, you must tell me what is happening or I will file a complaint against you. And I'm prepared to see you in court over this matter.
Okay, I understand that you are really upset right now, Puan Mariam. So, actually the reason why the doctor wish to keep this from you is because he is afraid of your response. So please keep calm and try to accept the situation first, and then I will explain to you about her condition. And I hope that you will try to be very tolerant and kind to her on this issue, because this is a really sensitive issue, and right now she really feels that she is alone on this condition, and she really needs your full support to assist further treatment lah. Okay, Puan Mariam, this may come as shock to you, but from my earlier examination, I found that Aisyah is pregnant. She has missed her period for 8 weeks, and also unfortunately, it may be an abnormal pregnancy, which is called ectopic pregnancy. Do you know anything about ectopic pregnancy?
I don't know, doctor. Are you sure, doctor? She's pregnant. Aisyah is a good and obedient girl. I really take a good care of my daughter. This cannot be happening. I think you made a mistake.
Okay, please be patient, Puan Mariam, because we have done the relevant investigation, and even your daughter had admitted to it. Now, what I need to do is, I need to refer her to the gynecologist at the GP, the general hospital, for further tests to confirm the diagnosis. And if it is really ectopic pregnancy, the specialist will need to advise you further regarding the treatment.
I cannot believe this is happening.
Yeah, I know, Puan Mariam. It must be hard for you to listen to this, but I need to inform you that if it is really an ectopic pregnancy, it is very risky for us to delay the diagnosis and also the treatment, because it may rupture and cause massive bleeding inside the tummy, and that can be life-threatening to her.
Doctor, can you explain more about Aisyah?
Okay, Puan Mariam, Aisyah may be having an ectopic pregnancy where her baby is not located at the proper place, which is normally in the womb, in the uterus, and in which again I must stress that it is an emergency case and can be life-threatening for Aisyah.
Okay, doctor. So what shall we do now?
Okay, I think I'm going to refer Aisyah to Hospital Raja Permaisuri Bainun, and there they will do further investigation and treatment for Aisyah, such as Aisyah may need to go to the surgery to remove the pregnancy lah.
Okay, doctor.
And Puan Mariam, I know that you must be upset, but I hope that despite all these circumstances, I hope that you can support Aisyah fully in psychologically and also physically, because all of us here is to help you and also your daughter. Do you have any question or anything more to discuss with me?
Doktor, will Aisyah die? Doktor?
Oh, no. Fortunately, we found this condition early, and also thankful to you because you brought Aisyah early to the clinic. Therefore, the outcome should be good and other complication that I've mentioned before can be avoided if we treat Aisyah early.
Okay, Doktor. Thank you, Doktor.
Sebuah alasanku tetap ada di dunia. Kamu bukakan kesempatan aku bahagia.